Good afternoon. By way of introduction, my name is Aziza Lucas-Wright. I am in the community faculty in the College of Medicine, Division of Community Engagement, as co-director with Dr. David Martins. I actually came to the university in 1986 and worked with a number of programs providing services to youth and families. I left in 1996, sort of halfway through there. We took the youth and family servicing programs out and incorporated ourselves and became Drew CDC, Drew Child Development Corporation, still a part of the Drew family. However, I left there again in 1996, so 10 years, and began to work in the interior, began to work with a number of community not-for-profits, providing a variety of different kinds of services and assistance in working within the infrastructures of a number of those agencies, providing mobilization as well as systems development, operating programs, conceptualizing projects, and working with evaluations, and beginning to do some very early preliminary work in community partner participatory research with RAND and UCLA as partners. I was working alongside Dr. Loretta Jones at her agency, Healthy African American Families, and she cast the vision with me about community faculty, and we talked long and hard about the efficacy of a community faculty for an academy. And so she had wonderful ideas, and she cast that same vision with Dr. Keith Norris, who was here at the university at the time in the Division of Research. At that time, there were some other researchers here and some other academic partners, faculty members, senior faculty members, who also caught that vision and thought it would be a wonderful opportunity for the university to bring in and overlay some training with doctors and other faculty and other students, in addition to the clinical pieces. Sort of what were the lessons that could be shared from community, and layer and enrich and sort of round off the training of someone who would be going into these same communities to work and to make a difference. And we are now here. So I was in the first cohort that was able to come aboard. Shortly after being here in 2010, I responded to a request for proposal that was on the table by Dr. Jadid Vagama in the Division of Cancer Research. I wanted to do some work in the faith community because I had a heart for the faith community. My husband was a pastor, but above and beyond that, my husband and I had both done quite a bit of work in our training in the African Methodist Episcopal Church around the importance of the faith community to African Americans on this continent. The AME Church is the first formal denomination and developed out of protests, so that appealed to me, my sense of social justice, and my husband's as well. And so we did a lot of work around, again, the efficacy of the African American church for community, how that the church was the hub of information, the hub of healing, the hub of self-empowerment. When I had an opportunity to take a look at this ability to do this research, the most likely place to go to find a denomination that understood the importance of education, understood the value of research, by going after church, going to church and asking for a little bit of open mic time during announcements, and also then going after choir rehearsal and other kinds of interesting ways. One church I went on a Saturday, on a day that they were doing giving a breakfast for the community, and was able to do that then. And one Saturday I went for a breakfast with just the brothers, and took along with me a young man who had been diagnosed with breast cancer, and that I had met at another church that I had gone to deliver or rather to have the surveys taken. I took him, I asked him, how would you like to come and talk? I'm going to speak to some brothers at another church. I think that they would rather hear from you than me. And so he went, and that was also very fruitful. That was my first piece of research, and it was called Present Your Body. which is just a slice of a verse in Romans that speaks about present your bodies a living sacrifice, holy and acceptable to God. However, when we look at, in terms of research and just living this life, having a body that you can use as healthy and that can be utilized for how you were created, living out your unction and living out your dreams and goals and the things, and again, from a church perspective, living out how you were created and what you were created for, how you were wired, as well as how you were shaped, being able to make that happen in a body, because we have to do it within this body. We took that same survey that, by the way, was developed by Dr. Mohsen Bazargan and Dr. Loretta Jones. May she rest in an aura of beautiful blue. So the three of us worked on that survey to make sure that it was relevant and that it was culturally acceptable. The research dollars were very modest. It was only $5,000. But with that $5,000, I was able to get over 800 participants to fill out that 7-page survey, because I took every dime and just we had it broken down into $10 bills in envelopes. A little open mic time and a very small and modest thank you of $10. A lot, again, the churches were extremely kind and gracious. And I have always said that I will not work with any other researcher who does not have a healthy respect for the black church. I will not do it. This is a direct quote from Loretta Jones. Researchers come into black community and rape and pillage, and then they're gone. We never wanted to be guilty of that, so we always wanted to make sure we left something behind that we leave, in addition to how to contact us. We always wanted to make sure that as often as we could, that we'd have dissemination conferences and dissemination learning events to share the analyzed data. One of the challenges that I see in doing community-based research is quite simply this. Community-based research, there's a progression. There was what was called sort of like the airplane or helicopter research, where research was done away from community, without community. Shortly after that, there began to be more of a direction toward having the research done in community. So it was place-based, but it still had very little infusion of the mind and heart of community in terms of planning and that kind of thing. And so now it then moved the next iteration, which was considered more progressive, was community-based, not just community-based, but community-based research, which actually was framed in this best iteration, community-partnered participatory research. It was community-based participatory research, but community-partnered, CPPR, is considered the gold standard, the blue sky of research, because it engages community from the very beginning. And there's a sort of like a clarion call in the country: nothing for us without us. Done the best way. A community representative who understands from its own perspective, understands the issue and understands what's going to happen, and can really assist in helping to conceptualize it and think it through and develop the narrative. Their presence should happen from the very beginning, not after something is developed in the ivory towers and then brought to community and to get a rubber stamp. Community can begin to talk about what will work. They can talk about what the relevancy of research. What is it that we really need, and this is nice, but we need this more. And so can you then turn your attention to that? And I realize that you have a wonderful theory. That's not the word I'm looking for, but a wonderful theory. However, this is what we need here. If you operate away from community and begin to develop your theories and all of that away from community, you might find that what you want to do is not synergistically possible or again relevant. Yours is way down on the list, and so they may be working with somebody else, or they may try to figure out how to do it on their own, because community will go ahead and try to work on its own issues, contrary to what some people may think. Community partner participatory research, one of the major pieces is that there's involvement of community from the beginning. And I think the challenges are pretty simple. First of all, researchers have to really respect those that they are building their the work that they're doing on. I realize that early on people sort of say, okay, I'm going to do the work here, I'm going to do this kind of work. But you really need to have your own personal, I think, your own personal mission statement about your work. I think researchers need to come with a sense, and I realize it's altruism and all of that, but if you are going to be the kind of researcher that can really see beyond T1, beyond the lab, you know, or move the T1 all the way to T4, from the lab all the way to you know, the bench, and work alongside it and produce and give the best kind of service and quality of service. You need to respect those that you are working for and working on behalf, and studying and researching. So there has to be that. I think that moving the heart and mind of researchers is important. So one of the challenges is to, I think, to get researchers ready to partner the correct way. Another challenge in doing community-based research is obvious. Black folk are, and other people of color, and other groups that have become what they call protected groups now, have had research done on them, and some pretty egregious kinds of research. And we don't have to search too far, and you don't have to just intone Tuskegee, because there have been plenty others. Knowing those kinds of things and knowing about research, we are reticent in the community to participate. So one of the biggest challenges is how to get researchers ready to do research with community, and how to help community to feel comfortable enough, to feel safe enough to participate in research. Because community wants to know primarily two things. We want to know, is it really going to help us? And two, are you going to hurt us? There's training, and there's some places of readiness that have to happen on both sides. Again, community has to feel confident enough and strong enough to sit at the table and be able to sort of pierce through a lot of the feelings that they may have about sitting at the table with these lofty academics. But all of those things have to be addressed and worked through, so both entities can get the best. And then again, academic researchers have to work on their feelings of, or their issues around elitism and those issues, so that they can successfully work with community and get the best. Academics measure what they can't do, and community can do what it doesn't measure or cannot measure. So both entities really need each other. My recommendation is always take the opportunity to learn about this community, those that you have set your buckets down and have decided that you're going to work for, that your research is going to be dedicated towards. Learn about why, find out why they have the kinds of outcomes that they have, why they are at the top of the misery index, why when they come into their office, they may not look happy, or they may be less interested in talking to you. Find out why they are willing to just turn everything over to you even. You need to find out more than just the biological. You need to find out the constructs, the sort of the social determinants of health, because that impacts absolutely everything, the way people move through life. And so if you're going to be at the top of your game and really understand really what you're doing, and possibly make some breakthroughs, because your understanding of somebody gives you a special understanding of what your barriers might be to best care and best aftercare of regimens that you might want to use, or and you can find out certainly whether or not somebody might even be willing to listen to you or pay attention to you if you find out how you can break through that wall. Often it has to do with the very simple fact or the very simple statement that Zig Ziglar, the great motivational speaker, said, people don't care what you know till they know that you care. Sometimes it's as simple as that. But you owe it to yourself and your research to find out what it might be. No community is a monolith. No one group is a monolith. So don't take the easy way out by reading a book and think now you know. You are looking at a group of people who had 400 years of servitude and daily maltreatment. And once released, not a single solitary law in their favor, and no set-asides. Released into a world that had nothing for them. They had no place to go. So laws began to be created, but not to help them. Laws to re-slave them. Laws around vagrancy and laws around things that they had no ability to change because they were groups of people from different plantations, again, that were released without resources. And this is a community that is still, as opposed to calling something, this is the underserved community, which sort of bespeaks people waiting back and sitting back and doing nothing and waiting for people to do something for them. Then take a look at how we're framing that. It should be under-resourced, not underserved. So there's lots of this need for discussion. We need to come to the table often to talk about what we're doing, why we're doing it, how we're doing it, and the discussions need to go deep. We need to tie some weights on our lines and go deeper. And so I close by saying, and somebody said that Muhammad Ali said this, but I know for a fact that it was Mary Wright Edelman, who's a friend of my husband's and mine. Mary Wright Edelman always used to close her sessions by saying, service is the rent you pay for being alive. I intone that often because I think that is absolutely true. But in that, I encourage you to never grow weary in well-doing. Thank you.